What is a nephrectomy for transitional cell carcinoma? Imagine a situation where cancer develops in the urinary tract, specifically in the part of the kidney that collects urine or the tube that connects the kidney to the bladder. When this happens, doctors often recommend a surgical procedure called a nephroureterectomy. This procedure is designed to remove the entire kidney, the ureter, and a small part of the bladder where the ureter connects, known as the bladder cuff. This comprehensive removal helps ensure that all cancerous tissue is taken out to prevent it from coming back or spreading further. Transitional cell carcinoma is a type of cancer that starts in the transitional epithelium, which lines the renal pelvis and ureter. Although it is less common than other kidney cancers like renal cell carcinoma, it requires a specific approach because of its location within the urinary tract. The main goal of a nephroureterectomy in this context is to completely eliminate the cancer and reduce the risk of recurrence or metastasis. The surgery can be performed in two main ways. Traditionally, it was done through open surgery, which involves a larger incision. Today, many surgeons prefer minimally invasive techniques, such as laparoscopic surgery, which uses small incisions and specialized instruments. This approach often results in faster recovery and less post-operative pain. During the procedure, the surgeon carefully removes the kidney, the entire ureter, and the bladder cuff to make sure no cancer cells are left behind. This operation is usually recommended when the cancer is localized to the upper urinary tract and is high-grade or aggressive. It is especially important if the tumor appears in multiple locations or shows signs of spreading. For patients who only have one kidney or have reduced kidney function, doctors might consider less extensive options to preserve kidney health, but in most cases, nephroureterectomy remains the standard treatment. In some situations, less invasive options might be suitable. For example, if the tumor is small, superficial, and low-grade, doctors might perform a segmental resection, removing only part of the ureter, or use endoscopic techniques with lasers or electrocautery to remove the tumor. These kidney-sparing procedures aim to preserve as much kidney function as possible but are typically reserved for carefully selected patients. Before surgery, doctors often use advanced diagnostic tools like flexible ureteroscopy to examine the urinary tract and obtain tissue samples. This helps confirm the diagnosis and determine the tumor's grade, guiding the decision on whether to proceed with a full nephroureterectomy or consider other options. Accurate diagnosis is crucial to avoid unnecessary removal of the kidney if the lesion turns out to be benign. It's important to recognize that nephroureterectomy is a major operation with potential risks, including bleeding, infection, and loss of kidney function. Patients need a thorough evaluation of their overall health and kidney status before surgery. After the procedure, ongoing follow-up is essential to monitor for any signs of cancer recurrence or the development of bladder cancer, which can happen in some cases. In summary, a nephrectomy for transitional cell carcinoma usually involves removing the kidney, ureter, and bladder cuff through a procedure called nephroureterectomy. While less extensive surgeries may be considered in certain situations to preserve kidney function, this comprehensive approach remains the most effective way to treat and prevent the spread of this type of cancer. Always consult with a healthcare professional to determine the best treatment plan tailored to individual circumstances, as medical decisions depend on many factors and ongoing research continues to improve outcomes.